move into, yep, we're going to go ahead and record. Um, and again, I just blown away. I love taking the time to let people share themselves. I know we've used a lot of the meeting for that, but that's really what this is about, is really creating those connections. And so the idea that we have folks from Oregon, Wisconsin, Ohio, Florida, California, Nevada, South Carolina, I mean, we're all over the place, and that's really what this community is about. So I'm very glad that you decided to spend your time with us here today. So for you Zoomer boomers, boomer Zoomers or Zoomer boomers, which one was it?
Zoomer boomers.
Okay. And anyone else who is unfamiliar with Zoom at this point. Our agreements, I think you guys all exemplify these, but basically this is the for those of you joining us the first time, these are what kind of guides our conversations, and it's important for us to, in essence, respect one another. We all come from different walks of life, and the beauty of the network is to open space that all walks of life are heard. And so these are important, and we'll send the recording around as well afterwards, so you can have these. So last month on our coffee chat, we started the year off with a learning mindset, and I think that's really important. The PFAnetwork has been going now for, I believe, 10 years now. Isn't that crazy? Started with 4 of us, and we now have over 1,000 people in the network. So that is pretty wild to me. But one of the things that's helped us to develop over time is our ability to continue with a learning mindset, or a teachable spirit, as we call it in the core competencies. And so last month at the beginning of the year, we thought about, what is it we need to know in this environment? Some of us have a lot of experience, some of us have a little bit of experience, but what do we need to know to take that next step into the current environment, right? Because I was thinking about, for us old timers, who I was on a PFAC in 1994. That was my first experience. PFACs don't operate, at least I hope they don't operate like they did in 1994. And so we need to be also upping our skills, right? And continuing to learn. So we had this conversation on the last meeting, and I just wanted to bring it back full circle here to talk about, or to at least report back on what we learned. So some of the new ideas that came back were to change practice, connecting the numbers to narrative. We know that healthcare improvement research runs on data, and we also know that we are the stories under that data. So how do we strengthen that connection? And I think that's a really important topic as we move forward. And then next, how can we, like Lisa was talking about, how can we be the catalyst for creating community connections, so that people in our own communities have what they need, or at least know where to go to get that? And how can we, again, be the catalyst for that? Because we're the ones who are navigating the community, right? It's difficult as hospitals start to screen for social drivers of health. They can get a list together of resources. Here's all the food banks in our community, or here's this, but they don't know, like, which food bank has food at the end of the month versus the beginning of the month, which loses funding, which already lost funding. So how can we be a catalyst for those connections? I think that's a really big opportunity for us. We even heard the idea at one point, having it be part of the Patient Family Advisory Council charter to create a number of connections to community-based organizations for the hospital. So thinking just really differently about that. Measuring the impact of our partnership, I think this is an area that really needs to be done, is we're lagging on, right? So constantly, even still, we get asked, what's the return of investment on patient-family engagement? And so we can share lots of stories, we can share lots of examples, but we don't have that measure of impact, like what changed because we were involved in the design process or in the improvement process. So measuring the impact of partnership, I think that's something that we can really uniquely contribute to. And so thinking more about that. I loved this term. This came from Barbara Kiewicz, bifocal communications. So that reciprocal communications, how do we listen as well as we share our stories? How do we also listen to our healthcare partners and understand their barriers, how what I'm saying fits in the context of their work as well. So I love that. Good. I see Emily's going to teach this course for us, so that's awesome. Agreement equals, yeah. The e-advisory role. This is a new. I think it's a new version of an old idea, personally, because we tried it in the 90s, and it didn't work very well because of the digital divide that existed at that time. But as things become, like it or not, that was one of the benefits of COVID, was we got more coverage and we got closed that digital divide to some degree. So what does an e-advisory role look like, and how is that an inclusive strategy so that more people can contribute to the conversation and to be heard? And so diving into that. And then peer mentorship, which is always kind of what we do in the network here, informally. Can we do that in some more formalized way? Perhaps, maybe that's something that we need to think about. Oh, interesting, Emily. So those were some of the ideas. So what happens with all these wonderful ideas now? We meet with our education system, Lindsay and Naomi. And one of the other, I guess it's kind of a sub category of the change practice, connecting numbers to narrative. Oh, no, it's not. It's totally different. One of the things that didn't make it up here was the idea of having a writers club within the PFA network. And it wasn't so much a skills exchange or developing skills as it was just people were interested in learning how to share their stories in written format. And so Naomi was able to make a connection with someone who actually teaches courses like that. And so what kinds of activities can we then bring back to the network? So right now we're considering kind of all of these ideas and looking forward to how we can lean into the method with which we develop skills exchange courses, which is basically, who do we need that has expertise in this area? And then how do we create a curriculum that elicits community learning, right? All of our skills exchange, if you've attended those, we provide a little bit of content and framework, but the true learning comes from everybody who attends that and shares their insights. So we'll do that in much the same method. Any questions? Sorry, I got a little bit jumbled there. Any questions about where what we collected last month is moving forward this month? All right.
I've got a question for you, Libby.
Sure.
Being new, I'm just trying to absorb what you're saying. With all of the organizations that are doing, I wouldn't say the same, but very similar type things. Okay, they're dealing with the same topics, the same issues. How does your organization, this organization, collect what like a best practices of how the the approach is being made in these areas so that we're not duplicating something that might be working for possibly somebody else. You know what I'm saying? Because I've just been associated with so many different things, and it's like we're all trying to do the same thing in our area. Collectively, we're all trying to approach healthcare with the same, optimism. How do we make an impact jointly with, holding the hands of others and with others moving forward in these areas? Are you getting information from other organizations on what they're doing, communicating with them? You know what I mean? It just
I
seems to
do.
me there might be a little bit of an overlap of what's out there. How do we approach it together? Does
It's a
that
great
make
point.
sense?
Yeah, it's a great point. And so it's a little bit of the connection between PFCC Partners and the PFA network. So PFCC Partners is the organization that hosts the PFA network, and PFCC Partners is also a patient and family driven organization, but we have contracts in different health systems, different research teams, different measure developers, where we actually build the patient family engagement strategy for them. And so we're always learning from our sorry, I'm admitting somebody. We are always learning from the contracts and the way that we're doing patient family engagement. And the way that we learn is that we continuously evaluate our practices from both the patient family partners perspective and the organization's perspective. And that's how we continually refine our approach. And so it's about equal parts of that perspective learning and then learning from the network. So on the call today, you've got folks who are, partnered with health systems and research teams all across the country. And so by having these conversations and by having other avenues for us to learn from all of you and your experience, we're kind of cultivating, if you will, the lived experience of all of us in that partnership. Does that answer your question?
Yes, it makes sense. It's just, I guess my big thing is we've all got so much to offer.
Yeah.
How do we put it all in the pile and make sense of it and do something with it?
Mm-hmm.
So that that we can utilize and make change and make an impact and do it in all of the areas that we want to do it.
Mm-hmm.
You know, I'm just finding you got a lot of people that have a lot of strengths and a lot of
Yeah.
experience and things they've gone through. It's like, how do you write the book?
Right. Right. I'm not sure I have a finite answer for you, John. I think that's part of
Yeah.
what this organization seeks to do together is, where we can have a consensus voice, we try to do that, and try to create that avenue and then move that forward to, CMS and other federal partners, so that we're being heard. So I think you've just hit on the essence of why we have the network, and that's really our
Mhm.
goal. Yeah.
No, thank you. I appreciate it. I didn't
Awesome.
mean to take too much time.
You didn't at all, and I appreciate the question because it keeps us thinking and it keeps us moving in the direction we need to go. And chances are, if you have the question, so does somebody else. So I appreciate it.
Well, being new, there's a lot of people that want to they want to find an organization like this. So it's like not only do you have the impact of what you're trying to do, but it's also the umbrella that's overseeing everything and making that awareness, you know, it make an impact as well. Hey, we're here, join us.
Right, right. Well, we're certainly open to all joining us, and if you would like to have a conversation as well, so one-to-one, just so that you feel confident in the way that you can describe the value of the community, I'd be happy to do that.
I greatly appreciate it. Thank you.
No problem. Lisa.
Okay, that I'm going to kind of dovetail on that. Now, the road, uh, shall I say, the roadmap to health equity and the access to quality care, from a measuring and data point, I think we would probably want to break it down with reporting. And let's say, for example, hypothetically, at the PCP level, where we're looking at data of ethnicity, we're looking at economic stability, education, social and community context, and again, the access to the healthcare, primary care, health literacy, obviously in the neighborhood, in the built environment. and the old saying is that if you can't measure it, you can't manage it. And so I would think, in moving along, if we wanted as far as an improvement, we would have to gather information because, we got a huge region, like you said, we're all across the board. And there would need to be, I think, some kind of baseline or something in order to just to be able to say, okay, what is health equity? And kind of coming up, I guess, with a mission statement, and then taking that mission statement saying, okay, well, we've got all these groups of people, how's it looking, in our region, in America, and being able to take those kind of groups of people and then doing the subdividing, and then again data, this is gonna have to be very data driven, and then taking the data driven and then taking a look at the resources on a national and state and local level, and saying, okay, we've got, food banks here, we've got maybe churches here, here, our health access, say, for example, in the rural areas on the Native American reservations where, you got a lot of food deserts and things of that nature, and just kind of looking at it from the bigger, maybe the big picture, and then just kind of going down, because it is overwhelming in terms of there's so many different things to address because we have so many different people, but you can make the connection as I think you move along. But again, if you can't report it, you can't look at it as data, and then you can't manage something you don't know. And so I'm just wondering, am I on the right path on this?
So, we definitely are very involved in promoting health equity on a number of different fronts. We have the DEI Leadership Council that helps us move this network forward in an inclusive way. We have created a DEI pledge that is now in all of our contracts, so all of our contractors know that we'll be intentionally working to open space for underrepresented groups, as well as all patients and families of that given community. So we've done a couple of those things. But I think what you're talking about as well is an opportunity that this group, I think, can be really pivotal in, and that is the requirement or mandate now that health systems collect, and I mean primary care and hospitals, that they collect race and ethnicity, and in a lot of cases, sexual orientation data that they collected. That's really scary and uncomfortable for a lot of people in the general public who may not understand why that's being collected, and therefore may have concerns about their citizenship, may have concerns about their privacy, may have, we heard from one of our partners, she was afraid to say that she had food insecurity because she thought they'd take her children. And so there's a lot of public awareness that I think we can be part of catalyzing. The reason that people are asking it, because the reason people are now asking is so that we can identify where those gaps are and where those deserts are, so that as a community we can start to fill those. So until we have a good idea of what the problem is, and the way to get that is to stratify that information, until we understand, we can't put resources to something, or we as a society have not in the past put resources to something that seems like a good idea, we need that data under it. So I do feel like this is a very rich place for the PFA network to start to have a consensus voice.
So I am on the right path. I'm new. I'm very new to this. And so I just want to make sure that I'm not off on a rabbit trail as far as my understanding. Then okay. Well, I think that you're absolutely right. I think there's a stigma. There's such a stigma of even talking about mental health. I mean, it's just so, and if we can break the barrier and put what I would call the kind of the census or of the general population into to an ease. And again, it's relationship building and trust on any level, whether it's of people of color or just whoever. I mean, I just,
Mhm.
again, if we can just have that strength in promoting that, that might be the catalyst to be able to have people to share, to talk, and it would create the space that we need in order to be able to not just to move forward in helping in areas that there is such a disparity, and we can make it so much better.
Mhm.
Absolutely.
Yeah, thank you, Lisa. I can hear your passion. I appreciate it. I'm going to take Chris's comment and then we're running a little bit short on time.
Just really quickly,
Yeah, go ahead.
patient privacy and privacy of your own information is such a huge deal. So when I work with employers, they need to develop programs to help their employees, but in theory, the employees don't want the employer to know their medical conditions. So it's kind of it's like circular.
Yeah.
So what we've been able to do is we have been able to do a business associate agreement with the employers and the insurance companies, and we capture the data, and then we reach out to the employees separate from the employers. I don't know if that makes any sense at all, but we have a diabetes program, and I get a list of people who've been diagnosed with diabetes, and we reach out to get them into a program. The employer is not involved other than to know that we have 10 of their employees in a program. And then we also have the ability, we have a data warehouse where we can track claims of people that have been in the program, claims before they went in the program and claims they went after, so that we could actually show the employer progress or whatever, impact to their plan.
Yeah,
I
great.
think that the PFA network needs to figure out who is that safe place, like we're a safe place for that data to go. Maybe it is the PFA network, but also where to get that information from. And maybe it's the community health workers. So the community
Mhm.
health workers are a trusted, they're a very trusted person to many people that are in need of healthcare. And
Mhm.
so I guess if maybe the PFA network is that role, but where do we get the information? How do we use it, and who do we share it with need to be really important questions to ask.
I appreciate that. Great ideas, Chris. And certainly community health workers are someone I feel like we just need to have a better connection with as the PFA network overall. And yeah, I think that's a great idea. I wanted to, this has been a great conversation. I really appreciate it. I'm going to just ask really quickly for your feedback over email because we're at the top of the hour. But one thing I really wanted to figure out is communications between folks in the network. So if you guys want to get in touch with one another after this call, how do you best do that? How do we manage that? What we have currently is the forum. And I think that the forum is a little bit underutilized. And I just want to remind everybody that this is a place where you can post things that are coming up for you that are important. You can post questions. You could post a request for help or mentorship. Whatever it might be, these forms are available to you to reach out to the rest of the PFA network. And I think this is probably the most expedient way to connect with one another. I think that as our capacity, you can send me an email and I can connect you, but I don't want you to get lost in my inbox and have that delay. So I think this is probably the best or most available source. I also wanted to mention that we do have a LinkedIn for any of those of you who are on LinkedIn. Any of you on LinkedIn? Some? Okay, about half. So there is a community there as well that you can have conversations and do the same posting of information and whatnot. But in any case, I would hope that you would all get into the forums and be able to connect with others there as well. And then lastly, any events, maybe you're going to be speaking at an upcoming event, or any important conferences you think people might want to know about, or maybe you know of one that is offering scholarships to patient family partners. Those definitely send to us so we can post those to the calendar on the PFAnetwork website. I don't know what's going on. Anyway, so with that, any other suggestions for better communication, please feel free to send them to me. I look forward to hearing from all of you. This has been a great discussion today, and I welcome those of you who are new and glad that you found your way to us.
Thank you. Thank you.
Thank you, Libby. Good to see
Thank you,
everybody.
Everybody.